Welcome to Autoimmunity Expert at autoimmunity.in. Autoimmunity.in is a platform for people with autoimmune diseases and their caregivers to connect, share updates, inspire each other through true inspiring stories. Today we have with us Dr. Suvrat Arya, who's a consultant rheumatologist and clinical immunologist in Delhi NCR. He also has his clinic, Dr. Arya's Care, in Noida. Hello, Dr. Suvrat.
Hello, pleasure being here.
So, why don't we start with what are the typical types of arthritis?
Yeah. So, arthritis means joint pain. Broadly speaking, we have two main different categories of arthritis. The more commoner one is the wear and tear arthritis, which could be related to aging, obesity, or trauma. And the other type of group of arthritis is the inflammatory arthritis, which usually has an autoimmune basis. The wear and tear arthritis usually is seen in elderly population above the age of 50, whereas the inflammatory one can occur at any age, but yes, it can start in early adulthood, so from 20 or 30 onwards.
Okay. What are the different symptoms that distinguish the wear and tear arthritis from the inflammatory and autoimmune arthritis that you just mentioned?
Yeah. So, firstly, we said the aging is one of the factors for wear and tear, obviously. Then is the joints which are affected. So, in wear and tear arthritis, the weight bearing joints, that is the knees and the hips, are commonly affected. Then, this joint at the base of the thumb, which is the most commonly used joint in the hand, is also affected. These patients usually don't have a very big swelling. They may have a little swelling in their joints, and the symptoms of pain usually come after doing a physical activity. So the pain improves with rest and comes with the activity. So this is completely opposite of what we see in inflammatory arthritis. In inflammatory arthritis, the small joints of hands, the larger joints like wrist, elbow, shoulders, knees, ankles, any of those can be affected. They usually have swelling, warmth, pain, and stiffness. And this stiffness is much more in the morning. So people of inflammatory arthritis usually complain of early morning stiffness, which improves as the day progresses and as they move around. So this is one of the major differences in the symptomatology.
Right. Now, what are the different types of autoimmune arthritis or the inflammatory condition that you mentioned?
Yeah. So the most common of autoimmune arthritis, which we commonly encounter in our clinical practice, is rheumatoid arthritis, which is chronic symmetrical joint arthritis affecting both small and the large joints. It, like other autoimmune diseases, it starts in early adulthood from 20 to 30. It may also start around 50 years, but commonly in the young adulthood. The other commoner one which we see is ankylosing spondylitis, which usually starts from the lower back. So it is inflammatory arthritis of the spine. Patient says pain and stiffness of the lower spine. Some people may have arthritis of the knees or ankles or shoulders as well of ankylosing spondylitis disease. Then we have some rarer diseases which can have arthritis like lupus, which is also called as SLE, in which besides arthritis, patient may have skin rashes, fever, oral ulcers, and other systemic manifestations. Then is psoriatic arthritis, which is usually seen with psoriasis. Again, the clinical presentation can be just like rheumatoid, affecting both small and large joints. And then is like rarer disease like mixed connective tissue disease and Sjogren's syndrome, which can have rheumatoid-like joint distribution.
Now, across all these type of different inflammatory autoimmune arthritis, what are the different treatment options available to patients?
Yeah. So for degenerative wear and tear arthritis, that is the osteoarthritis, our main aim is to control pain, ask the patient to reduce weight because obesity is one of the commoner comorbidities associated with this kind of disease, do physical rehabilitation, and ask some lifestyle modification. The inflammatory arthritis, which starts in the earlier age, is very amenable to treatment if picked up early, because there are a lot of medicines and drugs which are available which can control this abnormal immune response to in the joint. So these are non-steroidal anti-inflammatory drugs. Then there can be steroids, and then there are medicines called as disease modifying anti-rheumatic drugs, abbreviated as DMARDs, and then are the biologicals. So these are the lines of treatment for inflammatory arthritis.
So, if I understand correctly, what you're saying is that rheumatic arthritis is treatable,
Yes.
and these conditions you
Yes, we have to control the inflammation. It is very much treatable.
So we have understood that there are many types that you just mentioned. How does a patient understand that he needs to go to a rheumatologist's expert advice for his condition?
Yeah. So, rheumatology is a subspecialty of medicine. So, a doctor who is trained in rheumatology is a person who has been trained to manage rheumatic and autoimmune diseases. So, with a background of medicine, they have expert training in rheumatology. So, it deals with how to approach a patient of joint pain and swelling, and then give appropriate immunomodulatory therapy so that this abnormal immune response can be curtailed.
Thank you very much for your time today, Dr. Suvrat. It is always a pleasure to discuss these small differences and understand them for patients who are dealing with different autoimmune conditions. We will be back with more such smaller and focused episodes. For this, please like, share, comment, and subscribe to our channel so that we can bring you more such episodes. Thank you once again, Dr. Suvrat.
Thanks a lot.